NorthPoint, formerly known as Pilot City, is a full-service health and human services agency serving North Minneapolis residents. It is one of the original neighborhood service programs, or NSPs, started across the country in 1967. It was part of President Johnson's War on Poverty.
Community members and officials from different branches of government came together and they actually drafted the proposal, which went to HUD for funding. And there were several demonstration pilots across the country. There were 13. And in fact, Pilot City here in Minneapolis was one of the last demonstration projects to remain.
In July of 1967, Minneapolis received funding from HUD. It was in the form of a facility and planning grant. 10 months later, on May 19, 1968, Pilot City Regional Center had its first official open house.
The initial location was actually on Broadway, and then the city of Minneapolis purchased a synagogue that was here in 1968 and converted that into the regional center.
It was intended to be comprehensive. We wanted to bring mental health services up to the community, and that was absolutely unheard of. We wanted to bring dental services into the neighborhood. As an administrator, I really wanted to bring jobs to the community because Hennepin County did not have any people of color working at the hospital. And so we hired ambulance drivers, we hired receptionists, we brought everybody we could and got them full-time jobs with the county working up here.
Many of the organization's early employees were from the north side of Minneapolis. In addition to providing jobs for local residents, this new opportunity brought other professionals from outside of the neighborhood.
First group of us who came, we all did come from various backgrounds and different locations and different clinic setups and different models of delivery. So we had to really blend together as a group. We came together because we all had a basic belief that this was the right thing and the way to provide health care to a community in need of health care.
On January 20th of 1969, Pilot City Health Center became the first medical clinic in North Minneapolis. Later that year, both dental and mental health services were added.
And I think they had good health care here, and they always had doctors and nurse practitioners, really good people. And so people didn't have to worry about the care that they were getting.
In 1973, national administration changes resulted in a major loss of funding for Pilot City. Hennepin County began direct funding of Pilot City programs. In April of 1974, the new Pilot City Human Services building was completed. It expanded the number of services being provided to the community. Other noteworthy dates include September of 1992, when ground was broken for a new building to house the Pilot City Health Center, today's clinic building. Also, in 2001, Pilot City Health Center, Pilot City Neighborhood Services, and Pilot City Mental Health Center formed a campus integration initiative, providing a one-stop shop. Here, clients can receive services to address their social, physical, and mental health needs.
The type of services that we offer are some basic human social services. For example, we have one of the oldest and largest food shelves. It helps us concentrate on nutrition, making sure that people are able to provide good, nutritious meals for their family. We also do a lot of advocacy for helping families that are in crisis, particularly making sure that they are able to maintain their homes and don't become homeless, helping them make connections with employment, helping with attorneys. A lot of that work we're able to do in partnerships as well. And then there's the health services. We are a very comprehensive community clinic. We're one of the few clinics that have a full-service pharmacy, for example. We have a full dental clinic. We have a behavioral health clinic as well as our medical clinic. We provide transportation to your appointments here. We also have community health workers. They do a lot of follow-up after the patient has seen their doctor.
In 2003, the Community Board was formed under a co-applicant agreement between the Hennepin County Board of Commissioners and Pilot City Health Center.
That co-applicant agreement gave authority for the community board to operate the day-to-day of the clinic. All of the community health centers have to be governed by a community board. 51% of the members of that community board have to be patients of the community health center to ensure that patients were making major decisions about their health care and the governance.
In 2004, the name changed from Pilot City to NorthPoint Health and Wellness Center. The name NorthPoint was chosen because it had become a point of access of care for North Minneapolis residents, and the community board wanted to focus on health and wellness as a more comprehensive approach.
I believe the reason that Pilot City was the last remaining of those demonstration projects was because there was a lot of time and effort put into planning and bringing community members in collaboration with government officials to actually get a model that had sustainability. And the key to that sustainability was the involvement of the community early on.
In addition to community participation, Pilot City and NorthPoint have succeeded because of the people who work there.
The staff are indeed healthcare heroes. They establish relationships with their patients, with their families, and a lot of these relationships span generations. Actually, some of our staff started coming here as children and have established a career here and are giving back to the community.
I really loved my work. I loved my patients. I loved the kids. I fell in love over and over again with these folks.
So what does this organization mean to the community as we look back on 40 years of service?
I think Pilot City and NorthPoint has really given the community something to believe in, something to participate in, but something they actually help build and grow, and real community participation in the sense of it.
It is one of the pillar institutions. It is a place where generations of families have come here for health care, for social services, and they know that they are being treated with respect, and they know that it is truly an organization that sees the community and the people in the community as central to their being.